know what I mean?
Mm-hmm.
Because you just want to get their consent that it's okay.
Hello. Hello. I'm a student nurse, and I will be conducting this interview, and I thank you for partaking in it. We will take the information that we gather here and collect it, and this hopefully will better serve your needs. May I start with your name and your age? Jeremy?
My name is Jeremy Richard Carter. I'm 55.
And your date of birth?
December 25th.
And would you mind showing me your bracelet so I can check it?
Sure.
Thank you. And I see here, Jeremy, if I may call you that, that you are married, and is this your spouse sitting next to you?
Yes, this is my husband, Edgar.
Hello, Edgar.
Hello.
I would like to ask, for the record, to make sure we're clear on this, that the interview is with you, and if you're comfortable having Edgar, if you would like him to stay here, that is fine. Otherwise,
no, I want him to stay.
Very good. So we'll begin with the interview. Okay. Let's go to the second one, right?
Yeah.
Is that? You need to ask him the reason he came into the hospital. That's the one thing that we missed on there.
Okay. It's not on the script here, is it?
It's the last thing before you click to the next section. It says what brought you to the hospital. What
right
reason you
below
came
the
to the
box.
hospital?
Yeah.
Oh.
It's a little different.
Oh, gotcha. I didn't see it. Oh, it's not. I didn't see it. Okay. Okay. I remember one thing. Make sure there's a pause after I speak before you speak.
Oh, yes.
That worked fine because that was all seemed to be.
Yes.
And this is going to be more interesting here because there doesn't have to be pauses between the two of you.
Okay.
That you'll okay. Thank you, Jeremy and Edgar, and we'd like to start the interview now. May I ask you the reason that you came to the hospital?
Well, I couldn't feel my legs, and I couldn't walk, and I got scared.
Good. I'll get it.
Yay.
Great.
Awesome.
Jeremy, could you tell me a little bit about your health and medical history?
Well, I had colon cancer 2 years ago. I've had surgery, and I have a permanent colostomy, which I really hate. I was told I have to have chemotherapy again. I was told that the cancer is spread and that I'm going to need more surgery. I have a tumor on my spinal cord. The doctor thought everything was gone, and now it turns out the doctors are wrong.
Can you tell me about your hospitalizations and any surgeries?
It should be prior hospital visit, sorry.
Prior? Okay. I'll repeat that. Sometimes what I'll do is I'll start my next question, then we'll change.
Oh, that's fine.
Then you can just come in and cut and do that.
That sounds fine. Is that okay?
What?
What I'm doing now?
Perfect.
And like I said, and you don't feel that it has to be exact. So if you want to, she's here, the writer, and she has said if you want to put stuff in your own words, that's fine too.
Okay.
And even even if something is missed, then we just stop. She'll mention it. We'll go back and redo
Okay.
it because
All right.
that's what we'll do it.
Well,
Could you tell me about your prior hospitalizations and surgeries?
Well, When I was 12, I had an appendectomy. Two years ago, I had colon cancer. I had chemotherapy, but during the chemotherapy, I had a very low blood count, and I almost died twice. This has been a very upsetting thing for our family. It's been hard on Edgar.
Do you have any allergies?
Dilaudid. He was delusional last time he took it.
Do you have a history of family medical problems?
Well, my mom died of colon cancer. She also had panic attacks. My dad, who's still living, he has high blood pressure and he has heart problems. That's about it.
Still living?
Yes, my father's still living.
How would you describe your usual state of health? Is this close enough?
Yeah, it's perfect.
Because I can move it here.
No,
Okay.
perfect.
And I'll repeat the question. How would you describe your usual state of health?
Well, I usually feel fine. I don't really have an appetite. Last week I went to work. You know.
When was the last time you felt entirely well?
Three years ago. 3 years ago, I started having problems with my bowels. You know, I just haven't felt good for about 3 years. I mean, I make it through a day and then I'm just wiped out at night.
Tell me a little more about the events that led up to your coming to the hospital this time. Tell me a little more about the events that led up to your coming to the hospital this time.
Well, last week, I'm a car mechanic, and I was working on a Honda, and I was bending over the hood. It's really bad for your back, and at work my back started hurting, and I ignored it. I kept working, and I went home, and I took
Advil.
Advil, but it didn't help. In my legs, I mean, I felt tingling. Basically, my legs felt like they were asleep.
I basically had to carry him up to bed that night. And we still had some Percocet left over from your last surgery, and I gave him 2 of those before we went to sleep.
And then in the morning, my legs were paralyzed. I couldn't move.
I thought I'd overdosed him on the Percocet. We called 911 right away.
The ambulance drivers came. They didn't believe me. They stood there, and I told them, and then they took pins and they put them in my leg, and I didn't flinch. I didn't feel anything. And then they put me in the ambulance, and I got to the ER, and we had to wait in the hallway forever.
Oh. I was so scared. The memories from the last time we were in the emergency room were just still so vivid. I hate that we're back here again.
This has been really hard on Edgar. I mean, I think Edgar, I think it's been worse for him than it is for me.
Has anything like this ever happened before? you want to do the spouse line again? I was so scared, the memories of the emergency, the vet just hate we're back in here again. He starts to cry. I thought we had kicked this for now. Let him go a little bit longer with it and see that he might get the cry in or something. I mean, you are getting it's in. Okay, so let's just take it from.
And the only other thing that I was thinking is that when you say this has been hard on him, sometimes I think it's worse than for me. Like, you're still broken up about it. Like, you're like that. When I saw it, it seemed like you were still almost trying to be strong. Do you know what I'm saying? Like, you were trying to be the strong one, which you are in the scenario, but like, you're still. I mean, this is news for you. This is your life. This is your body. This is, you know, so you're still gonna be like. Sometimes I think it's harder for him than for me. Like, it's like you're still having a hard time with it, but you're also trying to be his rock to some degree as well. Does that make sense?
Sure.
So let's take it from. Take a pause before you start. I was so scared. Okay.
I was so scared. The memories from the last time we were in the emergency room were still so vivid. I just hate that we're back here again.
This has been very hard on our family. Sometimes I think that it's worse for Edgar than it is for me.
Has anything like this ever happened before? Let me try that again. Has anything like this ever happened before?
No.
This was the first and hopefully the last time this happens.
Are you having any pain now?
I'm always in pain. It hurts my back where the surgery was, down my left leg.
Okay, good. Let me ask the questions. Maybe try that. My fault. I'm not getting that in there.
Well, it's okay.
Have you any pain now? I'm always in pain. Can you be more specific? Where do you have pain?
Oh, okay, all right.
And then does it stay in?
I think it was okay.
You think it's okay?
But we can. Okay.
That's fine
okay.
by me. That's fine.
No, it's like, so the way that the interview, like the way that the students ask it, that's what but you said it, so they can just fill that into their slots. I think it was better.
Okay.
Because like, he would, as the patient, he would be describing all of that.
That's great.
So
Okay.
I think that just keep that the way it was. So you'll just kick it,
Let's take it from has anything happened before? Ready?
no, I think, just go on now, just go on to the things,
Just start again so we have a clean break.
So the one thing that is in there that didn't come out was, it goes down my leg. I'm happy to be feeling things in my legs again. So I'm not-
Right, I have that, and I realized I had jumped Alan's questions because I put dots because I didn't want to put all the things. But when I got to that part on my note, I thought, oh, I should wait for Alan to ask.
So, well, all right. Well, so then just pick it up and just go by the script then, just the way that it's written so that it's easier.
And whatever comes out will be. And we're going to start, has anything ever happened like this before? Has anything like this ever happened before?
No.
No, this was the first time and hopefully the last.
Are you having any pain now?
I'm always in pain.
Can you be more specific? Where do you have pain?
Well, in my back, where they did the surgery.
Does it stay in your back or does it radiate somewhere else?
Oh no, it goes down my left leg. Although I'm happy to feel something in my leg. You know, for the longest time.
Can you describe the pain for me? Is it sharp, stabbing, or dull, aching?
It's an ache. But when I move, it feels like a knife in my back.
Can you give me a number for your pain right now?
3.
Yeah, but he just took his medication about an hour ago, so...
What kinds of things make it worse?
Moving around. They make him walk all the time, and I know he hates it.
Is there anything that makes it better?
Ice. Ice helps.
I've been making sure that the nurses are up on his pain medication. Sometimes he forgets, and then it gets really bad.
Does the pain interfere with your daily activities? I'll take that again. Does the pain interfere with your daily activities?
Well, I went on short-term disability. I'm just always exhausted. A lot of times I can't work because of the pain, and now I found out that I need more chemotherapy.
That was the last thing we expected to hear.
Has it caused any disruptions for your family?
Yeah, it's been hard. It's been hard on our whole family.
We adopted twins from Vietnam 5 years ago. It's just been really busy.
We have a lot going on. For the past 2 years, we thought everything was getting back to normal, and
Perhaps there are some resources we can help you with. I'm sure this is all very overwhelming.
I mean, we would be glad to have all the help that you can give us.
Do you mind if I continue on with the interview?
No.
You said you had to go on short-term disability. Does your family have any other source of income?
Well, I'm self-employed, so I can stay home with the kids. I run a business that rents pony rides and inflatable games to birthday parties and carnivals, things like that. Business is pretty good, but I've had to hire more help since he's gotten sick. With me taking care of him and him not able to help, it's just been tough.
This has not been easy on us. It's not been easy emotionally. It has not been easy financially.
We've had to put everything on the credit cards again.
Can you explain that more?
Well, I'd like to say it's better now knowing what is ahead.
Yeah, last time we had no idea what was going to happen.
But my mom, my mom died of colon cancer, and we don't have any contact with our family now, especially once Edgar and I got married. Our families have disowned us. I'm like the black sheep of my family.
We have the kids to take care of and a mortgage to pay, and it's just really difficult financially for us right now.
It's not easy when you're sick. I mean, you got credit card bills. I mean, the credit card bills mounted after the chemotherapy, and it just feels like the walls are falling in on us.
We had just started to get out of debt.
You say, do you have a mortgage? Do you own your own home then?
I think that's the next card.
Yeah, that's...
Oh, sorry.
Oh,
That's okay.
nice. Oh. Well, good. Before we start, did you mention mortgage?
Yeah.
Yes.
Yes, oh, good, good. Thank you.
So, it doesn't have to come in, I want to keep that last one I thought was great, but it says, somewhere in here, try to put in, I guess there's going to be times where we have to go without in order to make ends meet. So, and again, it's just like trying to expose that financial resources or not. I mean, you clearly said plenty in here, but you want to just kind of say that like there's going to be some things that may get pushed to the side because you can't financially pay for it.
You could squeeze it in now. We're talking about the house.
Yeah,
Yeah,
that's true.
exactly.
Ready? You said you pay a mortgage. Do you own your home then?
Well, we had to buy a home in order to adopt our girls from Vietnam.
Do you live with anyone other than your 2 daughters and your spouse?
No. Our daughters and Edgar.
Do you like where you live?
Yeah, it's nice.
But I think we might have to move. With the financial strain, it's just that we're sometimes going to have to go without.
We can't afford to move. I mean, I don't know how much longer I might be around, and I don't want to leave it to Edgar to take care of the girls. And to move, Edgar would have to plan.
I am so sorry you have to go through this. I cannot imagine how difficult this time must be for the 2 of you.
Okay, let's go back. I want to do that last one. Do like where you live. So the beginning, it's fine, but the last piece of it says you need to be realistic about this.
Right. I was about to. I was going to squeeze that in to the to the next thing. But we can go back. Do you want to do where Alan asks the question about the house?
Do you like where you live? Yeah.
Okay.
And we'll just pick, because I want to put that into that one, because the portrayal here is that you're kind of like making sure that Edgar's set up and that you're, if you're thinking about the fact that you may be dying.
Right.
And so you want to, you're trying to get ducks in a row, but there's this really awkward period of time where everybody wants to stay positive and act like everything's going to be fine.
Right.
And everything's going to be good. And the physicians are very terrible at not giving you reality checks.
Sure.
But you kind of had this sense that I need to get things settled and straight so that if it were to happen, that I knew that he's going to have, not be, so far in over his head and
right.
things like that. So that's really kind of true.
What is the second thing that you're going to say?
It's just going to interrupt you. There's no.
Yeah, like you're trying to say.
Oh, I didn't put a note for
Yeah.
that one.
I was like, I see that he has the red line, and I just know he's going to be waiting for me to say something.
Yeah, it's like.
I try to interject, but you stop.
Okay.
Yeah,
All right.
He tries to say like.
I get it.
And you're,
Okay.
you gotta be realistic
I have to
about
make
this.
better notes next time.
Are you kidding me? These are fantastic.
Aren't you glad we have
Oh,
that?
God, yes.
Oh my! I'm really glad that I did. So the next time we do one, because I'd love to do other ones, I will definitely make these because it's more fun to be able to talk with Alan and be able to be confident that we know what the points we have to cover.
I mean, if that works, that's great.
Oh my gosh!
No problem.
I'm so glad that we're doing it.
I'm going to do this.
Okay, go ahead.
I'm going to do. Do you live with anyone other than your 2 daughters
Got it.
and your spouse? There's a simple no answer.
Yep.
And then I'll come and say, then do you like where you live?
Okay.
That's
Okay.
and that'll be clean into that. Okay.
Got it. Okay.
And I think you're whatever. Okay.
Okay.
You ready? Do you live with anyone other than your 2 daughters and your spouse?
No, just our 2 daughters and Edgar.
Do you like where you live?
Yeah, it's nice.
Yeah, but I think we're going to have to move. With the financial strain right now,
But
we're just going to have to go
we
without.
can't afford to move. Now, I don't want to leave moving to Edgar. I don't want to leave everything for Edgar to figure out. I mean, I don't know how much longer I'm going to
don't
be
say
alive.
things like that.
Be realistic. I mean, we have a few years at most. I'd be much happier if everything was settled with you and the girls before
I'm so sorry you have to go through this. I cannot imagine how difficult this time must be for the 2 of you. Is it all right to go on?
Please.
Do you have any support?
Wait a minute.
I know.
You should still look upset.
Yeah.
Oh, I thought it was Alan asking me if it was okay.
I'm ready.
It is Alan asking you.
That was Alan Carlson asking Michael. Okay.
Actually, you guys were so, and it was great. And if she would have seen that, then she would have written to go on, because
Well,
you guys were both.
sure.
I mean, after he just said, I can imagine how this time is difficult for the two of you, and you were really like destroyed.
You did a great job. Like, you know, I mean, this is all really super.
Well, the thing that I wanted to do, because these are nursing students, and you do these interviews, and it's very sterile, like, you know, but I want, you know, when you're visibly shaken, I want him to portray what a nurse should do correctly. You know, like,
Okay,
this
great.
is a really difficult time. Do you mind if I go on? Because that's the nursing students or sophomores probably would think to do it intuitively, but if they see it, they're going to pick up on that
Got
and
it.
then put it in.
Okay.
And that's the kind of stuff. And I loved the little argument. That was like fantastic. Like, loved it.
All right.
So let's take it from, you have just finished the last line, I would be happier knowing you were settled with the girls.
Okay.
You were breaking down and you were, okay. I am so sorry you have to go through this. I cannot imagine how difficult this time must be for the two of you. Is it all right to go on with the interview?
Yeah.
Do you have any support from the community? I remember you saying that you go to a Lutheran church.
Well, members of Trinity Lutheran Church, where we go, they have been incredibly helpful. I mean, they babysitting the girls. They bring meals. I just hate farming our girls out to other families.
Our relationships with our family since our marriage just haven't been great. And since we adopted the girls, it's really just terrible. They didn't understand why we wanted to adopt.
What about friends?
Well, before the adoption, we went out, we had friends, but after the adoption, friends of, you know, life goes on and things have just faded.
I guess you would say your spouse is your primary support person, correct?
Yes.
Is there anyone else you turn to if you need something?
We'll put the next one up.
Oh, sorry.
That's okay.
So into it. I mean, okay. Is there anyone else you turn to if you need something?
Well, our neighbor.
Oh yeah, she's a single woman and she loves the girls. She's great with them. And last time you went through chemo, she brought meals some nights.
Well, I never eat when I'm going through chemotherapy. I mean, I have sores in my mouth, and I just feel like I want to throw up all the time. And a lot of times I do. I mean, the chemotherapy, the nausea is the worst.
Has there been any role changes since you were diagnosed 2 years ago?
Well, I'm the breadwinner for the family, but now it's changed. I hate being a burden because you're taking.
You shouldn't feel like that. You know, you'd do the same thing for me if I was the one who had cancer.
I'm sorry. I'm sure this is all very difficult.
We'll start flipping them. That's good.
Do you have any social or cultural influences on your diet or your lifestyle?
Influences? Do you mean other than being a gay couple who's adopted 2 Vietnamese girls and has been alienated from our families? Do you mean anything more than that? No, that's about all we can handle. We're doing pretty good.
How about spiritual influences?
No, nothing that affects our life. I mean, we take the girls to church once a month.
I heard you mention nausea as mouth sores when you were, and mouth sores. Okay, good.
And then you can just turn it over.
I think we. Oh, you turn 12 over.
Yeah, you can just turn 12 over to 13 and...
So hand me these back, and then.
Awesome.
You want it right side up, don't you?
Minor detail.
Minor.
Yes, too.
Pay no attention.
I heard you mention nausea and mouth sores when you were on the last round of chemo. Can I ask you some questions about your physical health?
Yeah.
Tell me about the condition of your teeth and gums.
Well, my teeth are okay. I haven't been to the dentist. I haven't been to the dentist. Did you know that Medicare doesn't pay for that? Medicare doesn't pay for people to go to the dentist when you're having chemotherapy. I mean, we can't afford to go to the dentist. I can't pay to go to the dentist. What little money we have to spend on the girls. We think of the girls first.
If we get stuff there, that's an error on my part too.
Oh, I like that detail, though.
Well,
What is it?
It should be Medicaid instead of Medicare.
Oh, did you put Medicare?
Yeah.
Okay,
it should be Medicaid.
I thought maybe I was... All right,
No, it should be Medicaid, because you wouldn't be on Medicare yet.
Medicare's for old people.
Yeah, Medicaid.
Is
You'd
for
be on Medicaid because
is for poorer people.
Right. For
Not
people who
good-looking
can't-
people. I'm going to say, tell me about the condition of your teeth and
All
gums,
right.
okay?
Okay.
Tell me about the condition of your teeth and gums.
My teeth are okay. I haven't been to the dentist in months. Medicaid doesn't pay for dentistry. Did you know that? You go through chemotherapy and Medicaid, it doesn't pay for a dentist. We can't afford a dentist. And any little bit of money that we have, we put towards the girls. We can't afford it.
Please tell me if you have any of the following. Sore tongue, mouth,
No.
dry mouth,
No.
okay, let's say. I think that's sometimes, right? Doesn't matter?
Oh, you have sometimes. I understand.
So basically, everything's a no except the dry mouth, which is sometimes, and then, of course, the last one. Lesions that don't heal.
The only other thing is that you said that you had like slug in your mouth when you had chemo.
Right.
So you might just say, right now, no.
Okay.
You know, like something like that, because you don't have them presently because you're not on chemo yet. Does that make sense?
Yes.
But you're anticipating that, like, that was a big part of your, like, not being
Yes.
able to eat drink. So your answer, it says, please tell me if you have any of the following. So currently you don't have them, but you've had them in the past. So you just clarify, right now, no. But
For sores.
right.
Okay,
source.
got it. Okay.
Please tell me if you have any of the following. Sore tongue or mouth,
No.
dry mouth,
No.
bleeding gums,
No.
sore throat,
No.
hoarseness,
No.
lesions that have not healed,
No. No.
do you have any wounds, sores, ulcers on your skin?
No. I have to say, I'm not sure, are all of these no, or are there answers that See that's what I was looking for, because I know that
That's the
you've
next
written.
one. Okay,
That's okay.
my bad.
No. Because I know that I couldn't remember.
I'm trying to
what
figure
those-
this out here. That still says 13, but
Oh, look at.
well, maybe it doesn't. No, it's just the way this thing came out. That's all. My bad.
That's okay.
Okay. Oh, yeah, right. Yeah.
Oh, then we're on 14. There
Yeah.
you go.
It's a little bit different. I see. Hi.
My computer doesn't open DocX.
I guess not.
It messes it all.
It certainly does this weird shit, doesn't it?
It's like I had to read all the letters in a row.
And I remember you saying, can you do it? And I go, it's a little tough, but I don't get.
All right. So we can
I'm
go
going to
back
ask you,
to,
do you have any wounds?
Okay.
Okay.
All right.
Okay, ready?
Mm-hmm.
Do you have any wounds, sores, ulcers on your skin?
No, just the scar from the port and the ostomy.
He hates the ostomy bag. He thinks it makes him smell. I told you that it doesn't. Nobody can smell him.
Do you now, or have you in the past ever had sores,
No,
dryness,
my skin. Yeah, I mean my hands are dry. I wash them all the time. I work on cars.
lumps,
No,
hair or scalp changes?
well my hair fell out when I was doing chemotherapy. I mean, it's when I took chemotherapy again, it's going to fall out. I mean, I don't know which one is worse. Having chemotherapy or the ostomy.
Rashes,
No.
color changes,
Well, I am paler now than I was before I had cancer.
itching,
Well, no, it's only when I have chemotherapy or my skin's dry.
nail changes,
No.
Tugor, what's that again? Turgor. Do you mind if I check your skin turgor?
What?
It is a small test where I just pinch your skin a little to see if you're dehydrated.
Oh no, I'm not dehydrated. They pump me full of IV fluids. I mean, you can go ahead and test it if it helps you.
Do you have any history of unusual vomiting or diarrhea?
Vomiting? Oh, boy, I couldn't stop vomiting. Diarrhea?
I think his stool's a little looser in the pouch, but I wouldn't call it diarrhea.
Do you have any trouble with bowel movements?
I have no control since this pouch, and I hate it. I mean, imagine being at work, you stink. It just sucks.
You know, that is one good thing about the pain medication, though. You go less often.
When was the last time you had to empty your pouch?
Before breakfast.
What do you do to be sure that you have a regular bowel movement or help with the constipation?
Nothing.
Do you have any recent changes in bowel habits?
No.
Do you now, or have you in the past ever had rectal bleeding,
No.
tarry stools,
No.
hemorrhoids,
No.
diarrhea,
No.
constipation?
No.
Okay. You want to do that? No? You leave that? Okay. Is that where we're at?
Urination.
Yeah, we're into urination.
Deep in it. Hip waders.
Deep, deep, deep.
All right.
That's why we asked if your spouse was okay. Your spouse was here. That's one thing I have to work with the nursing students all the time. It's like you get so personal so fast. It's just like I said, I could be talking to someone about their sexual habits and their penile drip in the first 3 minutes that I met them. It's just you have to get comfortable with having.
Well, I was thinking about not those topics, but people doing things like that, whether you're a pharmacist or whatever. And I was thinking the biggest armor that you would have if you were somebody in your position, the biggest armor you would have would be your routine. To fall back on it, that you know you have to do certain things so that you can divorce yourself from the emotional part. Do you know what I mean? I think that would be a really important thing to get good at. You know?
Yeah, but in the same respect, because you're a human to human relationship, you can't divorce yourself from him.
Well, it'd be impossible.
Yeah, and it's so, but what happens a lot of times is that people do get emotionally divorced, and then patients perceive that as very poor care. You know?
Oh yeah.
It's kind of like the play
Oh,
fits.
what a fun! It's your bedside manner.
It's 100% your bedside manner.
Wow.
The perception from the patient's perspective, and so that's
Wow.
that you have to teach this. You have a routine and you have expectations and you get those things done, but in the same respect, in order to be able to meet patients' needs, you have to be able to connect.
Wow, what a
emotionally.
funny juggling tightrope kind of thing.
And that's what Healthcare Theater is so good at doing that nothing else has been able to do.
Wow.
Because you have to be able to go through the routine and prove that you can make the clinical judgments and do those things, but at the same time, addressing these subterfuge that all patients come into the hospital with, and connecting with them emotionally.
Right.
So
Wow.
There's a lot that goes into it, and that's what this does so well.
Wow.
Yeah.
Well, here we go to urination.
You ready?
Okay.
After that, we'll go to urination, okay? Okay, how about your urination?
No problem.
What do you do to be sure that you urinate on a regular basis?
Nothing.
Do you now, or have you in the past ever had polyuria?
What?
Polyuria?
What is that?
Don't know.
It says, make the interview, explain the questions.
So Alan's gonna be the interviewer.
So just answer fucking no to each one.
Well, we'll say no.
Yeah.
Well, wait a minute. They should have to learn. I want them to learn to. That's why I have that.
So
in
let's
there.
pick a couple that
Yes.
we can get Alan to
So
understand.
polyuria is having to go to the bathroom more often than normal.
Okay.
More than your normal amount.
Mm-hmm.
Nocturia
Nocturia is going at night.
Going at night.
Okay.
Uh,
Burning pain with urination.
What is that?
I don't understand.
Hematuria. Let's explain hematuria. That's blood
Speaking.
urine.
Okay.
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 And then the other one, just note everything.
So why don't you do this? Because I wasn't paying attention which one. Why don't you just lift your hand a little bit, and I'll know that's the one I'm supposed to say. What is that?
Yeah. We're gonna
Okay.
Great.
So
Okay.
all you have to do is just lift your hand a teeny bit, and then I'll play along.
Do the first three that you don't know, which would be polyuria, nocturia, and hematuria.
Okay. That
Okay.
sounds good.
Do you now, or have you in the past ever had polyuria?
What is that?
Going to the bathroom all the time.
Oh, no.
Nocturia.
What?
That's
what-
going to the bathroom at night.
Oh, no.
Burning or pain with urination.
No.
Hematuria.
He.
That's blood in the urine.
Oh. No.
Urgency.
No.
Change in force or amount of stream.
No.
Hesitancy.
No.
Dribbling.
No.
Incontinence.
No.
Urinary infections.
No.
Urinary stones.
No.
It's the next one, are we? Yes, we are.
I'm going right through this.
Is this it?
This is 17.
Yep, it is.
Yeah.
Yep, that's right.
Heather. Oh, that's healthier.
Healthy.
Who the hell is Heather?
Do you have a problem with Heather?
Have you,
Get that, Alan.
have you been having an affair with a girl named Heather? Sorry, Edgar.
God.
Edgar.
Okay.
All right.
And that was good. Remember where we're coming from, because those were all questions you didn't like to answer.
Right.
Yeah, that was good. Now I have a few questions that relate to your lifestyle. I'm trying to see is if there is any way we can help you live a little healthier.
I just want to live longer. I will never be healthier. We have. I'm sorry.
You don't have to be sorry. Come on. We just want to get you better. Let's answer the rest of the questions. Come on.
What is your usual activity level?
A week ago, it was good. I get tired a lot, and I have no appetite. I thought I was getting better.
I mean, he's able to work and play with the kids. You help me with chores when you have the energy.
Do you feel like you have enough energy?
Well, with the chemo, I get really tired. But you know, after work, you know, I come home and I'm just exhausted, and I just collapse. And
Okay, we can give you that one. She's since the chemo. Because you're not doing the chemo right now.
Thank you.
Since the chemo.
Since the chemo.
Because, like, what happens is when you go through a chemo regimen, typically you never really fully bounce back.
Got it.
So, and you're also, like, anticipating the next round.
Right. Thank you for pointing that out.
No problem.
All right, we'll do the energy question.
Do you feel like you have enough energy?
Well, since the chemo, I just get tired. I get tired really easy. I go to work and I come home. I just collapse. I can't do anything.
Okay, new question.
And I put 18 and 19 on this one by mistake, but it's
Are we okay there?
yeah.
Okay. You said your appetite has been poor lately. Mm-hmm. Can you tell me what you eat in a typical 24-hour span?
Well, chemotherapy killed my taste buds. Gone. Breakfast, get up at 6 a.m., go to work, toast, coffee, milk. Lunch, I don't eat lunch. Dinner, I get home at 5, dinner at 6. I eat because of our girls. I don't want our girls to worry. Edgar doesn't want our girls to worry, so I eat. I eat potatoes, rice, starch, applesauce. At night, I have a snack. 8 o'clock. I treat myself to a cookie and some milk. And then I go to bed.
You told me about the colon surgery and ostomy. Have you had any other past medical problems or surgeries related to your ability to eat, drink, process your food, or eliminate waste?
Okay, we got to ask that one again.
I got to say that again anyway.
I have on my notes, I have abdominal. Yes. So I wasn't sure. Is there an answer to that one?
Oh, there is.
There is?
Yeah.
Did I miss it?
No, we're coming up to it.
Oh, I didn't put no. That's
Yeah.
my problem. I was looking at my notes going, I don't know what to say.
Yeah. We're going to come up all that, okay?
Okay.
Let me try this again.
Okay.
You told me about the colon surgery and ostomy. Have you had any other past medical problems or surgeries related to your ability to eat, drink, process your food, or eliminate waste?
No.
Any tests, for example, x-rays or blood work, done for problems related to your ability to eat, drink, process your food, or eliminate waste?
No.
Do you now or have you in the past ever had abdominal pain?
Yeah. That's why I went to the hospital.
Jaundice?
Being yellow? No.
Change in appetite?
Yeah.
Food intolerance?
No.
Liver problems?
Yeah. I mean, I used to drink, but not since I was sick.
Nausea?
No.
Excessive belching?
Yeah, wait a minute. You gotta do the nausea one again. You have had, remember you talked about how you have this nausea with chemotherapy, so it's not recently.
Oh, so the answer is not recently.
And
Okay, I
vomiting,
put
same
no.
So nausea and vomiting both would be not recently, because that really hasn't happened since you've had your chemotherapy.
Got it. Okay. Not recently.
I'm going to start again. The list, you want to?
Sure. Nausea and vomiting, not recently. Got it. Okay.
Do you now or ever...
Oh wait, can I say one more thing?
Mhm.
Like the abdominal pain is what started you to go and get your diagnosis of colon cancer. So it says the abdominal pain is yes, that's why I went to the doctor in the first place. So it's, I think you said that's why I went to the hospital.
Right.
So they could assume from this hospitalization. Is that, you see what I'm saying?
Yeah.
Like this hospitalization came in because you had that numbness and tingling in your leg. So you could just say that yeah, that's why I went to the doctor. You know,
The first time.
Yeah, the first time.
2 years ago.
Yeah.
Got it.
Exactly.
Nausea, vomiting, 2 years ago.
Ready? Do you now or have you in the past ever had abdominal pain?
Yeah. That's why I went to the doctor 2 years ago.
Jaundice?
Yellow? No.
Change in appetite?
Yeah.
Food intolerance?
No.
Liver problems?
Well, I used to drink. That was, but that not since I was sick.
Nausea?
Not recently.
Excessive belching?
No.
Gallbladder problems?
No.
Vomiting, regurgitation?
Not recently.
Indigestion?
No.
Trouble swallowing?
Is this one on that next one? There's something about swallowing. I remember you. It was about.
I didn't even see that in this one. It's like excessive belching, gallbladder problems, vomiting, and regurgitation.
Indigestion once in a while, trouble swallowing every once in a while, feels like there's food got caught in my throat, and
Oh
vomiting,
yeah,
blood.
I think it might be on that number 20. I don't know.
No, it's like on this one.
You don't have it on yours.
Oh, there you go.
I don't have it on mine either. How did you get it and nobody else?
I have it.
I sure didn't make a note about
You
that.
have it too?
Yep.
Well, what do you want me to say? I'll say
here we
whatever
go.
you want me to say.
I'm going to do that again. You might want to, the
Indigestion.
gallbladder
The gallbladder is no.
No.
Did they take that out when they gutted me?
And you're supposed to
And
listen.
his spouse
I
says,
don't
shakes
think- I
head
don't
no.
think- I never had that.
That one I have. Here, Alan.
I
No, you didn't have it because
didn't have it.
your thing doesn't.
My Doc X.
Your Doc
My
X
Doc
doesn't do
X
it.
doesn't. So what am I supposed to say when they gutted me on the fish?
Gallbladder problems. No. Did they take that out when they gutted me? And I go, no. And then not recently. And then the packet. Indigestion once in a
We'll
while.
take.
Trouble swallowing. Every once in a while, it feels like food gets caught.
We're on the next to last page. So abdominal pain, you know what that is,
I
right?
know what abdominal pain is.
With the
yeah.
doctor in first place. And there's jaundice.
Jaundice.
Is
not
that
recently.
a
Oh,
yellow skin? Yellow skin?
Yellow skin?
Yeah,
No.
good. Okay, and then change in appetite.
No. Yes.
Food intolerance.
No.
Liver
Used
problems.
to drink, but not since I've been sick.
Nausea.
Not recently.
Excessive belching.
No.
And then there's what is excessive? No, I think I'm normal. If you want it, it's there for the taking. What is excessive? No, I think I'm normal.
I have a good time when I break this.
I think you ought to say. No, I think you ought to say that.
What's excessive?
What's
No,
it?
he's normal.
No,
He's
no.
used to say
I
it.
think you ought to say it because you haven't said it.
No,
for a
what is
while.
excessive? No, I think he's normal. Gallbladder problems? No, did they,
No.
Did
Did they take that out of me?
when
What?
they gutted me?
When they gutted you.
Did they take that out when they gutted me?
When they filleted me?
When they filleted you. I don't think so.
Shakes his head, no. Vomiting, regurgitation? Not
No,
recently.
Not recently.
Indigestion? Once in a while.
Once in a while.
Trouble swallowing? Every
Uh,
once in a while it feels like
Feel-
food gets caught in my throat.
Feels like food gets caught in my throat.
And the last one is,
Metastatic tumors.
Yes.
That's why you have that.
and the last one is vomiting blood in the stool. Vomiting blood or blood in the stool.
What's
That's
mentioned?
no.
But later on, there is something about swallowing again. Am I correct? My brain was getting tripped up because I'm like, I know I saw it, but it's like on, it's
down in the nutrition
so okay. So I'm not totally crazy.
No.
I'm just not in the right place. Okay, great. So I will do my absolute best to get those answers.
Yeah, that's on the last page. It says, do you take any vitamins? No, I take pills to get caught too.
Right. That's
it
what I
is.
was thinking about the swallowing.
So we're going to do we're going to start with abdominal pain, that list,
Okay.
okay? And we'll go for it. And whatever happens, happens.
All right.
Okay. Do you now, or have you in the past, ever had abdominal pain?
Yeah. That's why we went to the doctor 2 years ago.
Jaundice?
Yellow skin? No.
Change in appetite?
Yeah.
Food intolerance?
No.
Liver problems?
Well, I used to drink, but not since I was sick.
Nausea?
Not recently.
Excessive belching?
What counts as excessive? No, he's normal. Oh, God.
You don't need to come look in the ER with these big pieces on me.
That was really great.
I
It was
think,
so great, we couldn't hold it together.
I think we should keep the. Well, maybe it doesn't totally fit the music of what's happening, but it would be good to.
Can we try one more time?
Sure. I think it's funny. We just can't laugh as much.
No.
But I think within it we can laugh.
Oh, you can.
Within the envelope.
And if it's too much, I'll just go on to the next
Okay, that's
question.
good.
No problem.
All right.
Do you now, or have you in
No,
the...
just go to excessive belching. I can't do this again. Just do excessive belching. This is number 4.
Okay, here we go.
Excessive belching?
What counts as excessive? No, he's normal.
Gallbladder problems?
No. Did they take that out of me when they gutted me?
I find it funny that you guys guys find it funny.
Morale's good.
Yeah, morale is good.
That's what happens when the cows see the gate. They're all ready to go. They're starting to drip their milk already. All right. Excessive belching. Ready?
Yep.
Excessive belching.
What counts as excessive? No, he's normal.
Gallbladder problems.
No. Did they take? Did they take that out when they gutted me?
No, no.
Vomiting, regurgitation.
Not recently.
Indigestion.
Not much.
Trouble swallowing.
Yeah.
Vomiting blood or blood in the stool.
Oh. Not recently. No.
Do you eat your meals with anyone? New page? Yeah, it is.
Oh, page 20 or section 20.
Here it is.
2 more, and then we're done.
Ready?
Yep.
Do you eat your meals with anyone?
Well, we try to eat as a family. We have dinner as a family, and we have breakfast on the weekend.
Who prepares most of your meals?
I do.
You know, on the weekends I cook. You know, if I'm not too tired.
How would you describe mealtime? Pleasant, stressful, rushed, unhurried?
Well, pleasant. It's only stressful if people stare at me and are worried.
Describe any current or past dieting about type or length or success of your diet.
Well, I've always been skinny. I don't diet at all. There's no need to diet.
Are there any foods that you avoid? If so, why?
Well, pretzels, things that are hard and scratchy, they get stuck in my throat.
Do you take any vitamins or other nutrition supplements, high protein drinks, high fiber supplements, for example?
Well, I don't. No, I don't take pills. Don't take pills. Don't take vitamins. They just get stuck in my throat.
Body mass relative to height? No.
And now
That's-
it's
You know,
card
you
21.
should actually ask how tall he is and how much he weighs. You should have done
Okay.
that. I don't know why that's not in here, but this is where you should ask how tall he is and how much he weighs.
And
Okay.
I'm 5'8" according to this, and it didn't say. So,
70 kilos, which would be 140 plus.
oh, sure, don't look 140.
No.
I'm a healthy
No,
140.
I have to add in the 2.2. 155. You're 155
Okay.
pounds.
Can you put up card 21, and then we don't have to.
Does this mean yay?
No, I put red marks for myself and for Zach.
The red mark for this one is just me
Thank you.
comforting you because I'm reliving these experiences with you.
I just made marks where Zach was scripted to do things for Zach's benefit and mostly for mine, so that I knew to expect stuff.
I'm going to ask you for your height and weight.
Okay. All right.
Could you please tell me your height
5'8",
and your weight?
155.
How much alcohol do you drink?
None. I mean, I already told you that. I don't drink.
Have you ever used marijuana, cocaine, heroin, crack, or similar drugs?
I smoked some pot. I mean, I smoked it when I was doing chemo. Boy, that really helps. I smoked a little bit in high school and smoked in college, so I wasn't afraid of it. It's really helpful.
Have you ever used sleeping pills, diet pills, painkillers?
Well, I'd love a sleeping pill. I have a terrible time sleeping at night. I mean, I lay awake in the morning, and I just think about our future, and I know I'm going to get a new port, and there's a new round of chemo coming up, and I'm going to be losing my hair, and it's too much. It's too much.
Would you say that you are feeling a little depressed?
Yeah. Especially at night.
Maybe there is something we can offer you to help you with your depression as well. I really want to thank you for taking the time to answer all of these questions. I am going to take a look at this and see where we have some suggestions or resources to help you. Thank you, both of you.